Hi, my name is Erica, and we're going to be obtaining some specimens today. First specimen would be a clean catch midstream urine. What is that? A clean catch midstream specimen is a collection used when a provider wants to test the urine for bacteria. Bacteria found in the urine that can tell us whether or not a person can have some type of urinary tract infection. Um, at our facility, if someone orders a clean catch midstream, the provider also is going to want a urine culture and a urinalysis, and shown in that picture right there. Whether we're checking for some abnormalities such as leukocytes, pH imbalance, um, ketones, and some other testing. So the process that we're going to do, I always tell patients to wash their hands first. Generally, because I work with the children population, I put a hat in the toilet, and urine can be collected within that hat. Parents would go in and assist the children with this. Um, if it's a girl, I let the parent know, here's the cup, here's the wipes, be given moist towelettes to clean off any skin-like bacteria. So first, I tell the parent to wipe front to back on one side of the vaginal area, front to back on the other side of the vaginal area, and front to back down the middle. Once those are done, discard those wipes. The child will then urinate a little bit. We'll move the hat and then put the hat back, or bring the cup up under the patient so that you can void into the cup directly. Put the top on the urine specimen, like so, in that picture. We're going to put that on tightly so none of the specimen would spill out, or we would have to call back for a new specimen collection. Flush, make sure you wipe the area, the vaginal area, wash hands, flush toilet. The next specimen that we'll be talking about is a stool specimen. Stool specimens culture or collection of feces collected to find also another bacteria. Um, it is ordered when a provider or doctor um, has, or the patient shows signs of unrelenting diarrhea, fever, abdominal pain, or bloating for more than 2 to 3 days. Um, Also, to find any parasites in the stool or bacteria. Most likely, if it's in a hospital setting, I have seen doctors order it if a patient is suspected of um, C. diff, most likely from being on antibiotics too long or other things. So I have a picture here, or a diagram. I place the hat in the toilet. I have a cup in the bathroom. Um, Once the person has uh, defecated, I guess, um, they would put on the call light. I would go in, take in one of these specimen containers, and I believe it was shown in the last slide, looking something like that. And as you see, it has a little spoon. Most likely, if a person has C. diff, it's really loose, mucousy, So I would use like a regular plastic spoon out of the hat into the cup, but first glove, always glove first. And if it's loose enough, it'll pour into the specimen if the stool is loose enough. If not, we only want semi-formed, not formed urine. I mean, formed stool. Formed stool, we really can't, they can't test with that because they have to do a smear. Once the feces is collected into the container, put the top on tightly, label the specimen. You want to check with the person to make sure name and date of birth is correct by checking either the armband, asking the patient name and date of birth. After this is done, remove gloves and wash hands. Next specimen is a sputum culture. Sputum cultures are obtained to also find the presence of bacteria. Most common is pneumonia and other bacteria. You want to collect this specimen early in the morning before drinking or eating even happens. Um, like right when they first wake up in the morning, patients are to get, because we all wake up with some form of phlegm or mucus, and we want to make sure that we get that up and into a cup. So normally, when I worked in certain facilities, if I worked 3 to 11 or 11 to 7, I would make sure I put a labeled cup into the room. Or if a respiratory therapist would ask me to, get a labeled specimen cup, put it in the patient's room, make sure that that cup belongs to that patient and their name and date of birth is matched or identified. We want sputum to be thick and mucus-like, not clear and thin. That is saliva. So what we're going to do is have the patient sit straight up. If a person is on a nebulizer, once they get their treatment, it'll loosen up some of those secretions to bring up the mucus. When they're sitting up, I want them to take several deep breaths in and out. In through the nose, out through the mouth. In through the nose, and that will help also bring up some of that sputum that we need for the test. Once they feel that it's up, bring the cup up to them, tell them to spit into the cup, making sure that it is thick, not thin. Once they've done that, close the top, verify name and date of birth once again, take off gloves, wash hands. And I also put some things on this last side of things to remember. I'm always all about labeling specimens, especially at our facilities. Sometimes things are hectic and short, but one thing I'm about is labeling specimens because I also used to work in a lab, and there's nothing like someone mixing up blood samples, sputum samples, anything come down. When I was a lab tech, I also received specimens. I would get that angry call, and if someone is misdiagnosed, wrong medication can be given. It can lead to a lot of things. So please remember to label all specimens. Specimens are to be labeled in front of the patient. A lot of people don't do that. Depending on what facility you work at, we're trying to do things short and quick, but labeling a specimen in front of the patient, letting the patient see or matching it to that armband is very important, making sure that patient is who they say they are. Use 2 patient identifiers. One, by asking the patient to, checking the chart or checking the armband for the patient. Bagging all specimens. Bagging all specimens to make sure that there is no spillage. You can't just send a specimen just loose. Bagged specimen will be taking more than one just coming down with just handed tubes, especially at the hospital that I used to work at that didn't have a suction system or somewhere where you could put it. At our facility, it's an outpatient care office, so bagging a specimen is important because people come to transport those specimens to the main hospital lab. We do not have a lab on site, so what they do is if it's a specimen that's not bagged, it is not tested. Also, make sure the rec. Usually, a specimen will come with a printed rec that has a little pocket outside of the biohazard bag. We want to make sure that that biohazard bag has the rec inside, is closed, rec doesn't fall out, that it matches what's on the inside of that, the specimen that's on the inside of that bag. Hopefully I did this right. Thank you very much.